Good afternoon, everyone. Madame la Ministre. Merci, Benoît. So, it's delighting, but it's also I'm a bit moved to welcome you here. This is the last meeting. It was really a good adventure together, and I hope we'll have further ones. I would like to now have some introduction speeches with these three important people. Isabelle, who is representing Sciensano on behalf of Christian Léonard. She's a scientific director for infectious disease. Hein, my now friend, who is the scientific coordinator. And we work together, as you know, over more than 5 years. And finally, the most important one that we will start with, André Jestin, who is at the origin of the One Health EJP of this adventure, and even before at the origin of the network of excellence, MedVetNet, that paved maybe the first basis of what we now call One Health. André, maybe you can tell us a little bit how it all started. Please, you can take the mic.
Thank you, Arnaud. First of all, I want to thank the organizer for their invitation. And it is a great pleasure for me to be here today. En présence de Madame la Ministre, Madame Firmin-Lebaudot, thanks to the General Director of Anses, Monsieur Benoît Vallée, thanks also to Arnaud Callegari, to Hein Imberechts, my old co-workers, and thanks to all of you. It is pleasant for me to remind you the success story of MedVetNet. After the BSC crisis, the first idea was to set up a food vet network, submitted to the European Commission, who refused this project. And the invitation was to set up not a food vet, but a MedVet consortium on foodborne zoonosis. A network of excellence was funded in the Framework 6. 14 million were allocated for the research and the reference activities for 5 years, and the scope was on foodborne zoonosis. 14 members, Med and Vet Institute, public institute with expertise in research and reference on foodborne were committed. Even if this project has been very successful, the EC refused to plan a second round, not allowing the follow-up of this initiative. We had many discussions on the best way to maintain the consortium alive without grant from the EC. The consortium decided to jump from the EU-funded network to a self-sustained association of public institutes. All members were in favor of the establishment of one association with limited budget to maintain the structure and to prepare a new EC-funded project. I call it was the Desert Crossing from 2010 to 2017. With Arnaud, with Hein, the member of MedVetNet Association members, we were very motivated to find a way. The first idea was an Article 169 or 185, suggested by Laurent Bauchereau and Jean-Charles Cavit from the Commission. We identified in the landscape IMERA, coordinated by French teams, an Article 185, which were in place and working well. And this article was on metrology with research and with reference activities, in which the Ministry of Authorities were committed as co-founders, exactly what we were expecting. The first project was drafted by MedVetNet Association investigating the feasibility of one article on 185 on foodborne zoonosis emerging threats. Unfortunately, the general director of DG Research in Brussels invited the consortium to postpone the project and to think in terms of an ERANET, classical ERANET. But we were not totally disappointed. After discussion with colleagues, Jean-Charles Cavit and the members of MedVetNet Association, with the presidents, Roberto Laragione, Arjen van de Gissen, a meeting was organized in 2015 with the EC scientific officer Jörg Niehoff, DG Research, Luis Vivas Alegre, DG Health, and Jean-Charles Cavit, DG Agri. We learned that the DG Agri wanted an EJP, a European Joint Programme, a new instrument. We were invited to prepare a pilot project co-managed by DG Agri and DG Research, but that was promising, but totally new for the consortium. But we had a lot of work to do. We immediately noted that difficulties exist to take on board the environmental challenges. A 5-year research project provided by managers of MedVetNet Association was drafted and sent to the EC. EC co-fund will support 50% of the total cost of the collaborative research project. That was quite new for us. EC was expecting in-kind contribution counterpart from the members. It was suggested by the ministry to include national funding agency for extra cash calls, for external calls. Such option was finally not selected. We were not really enthusiastic by this initiative because it was too complicated at this step, to deal with a search, project. If the EJP was co-managed by DG Agri and DG Research, the grant has been strongly discussed because at the end, DG Agri was funding 40 million euro, DG Research was funding 5 million euro, and the member state funding 45 million euro. The volume of resources was, of course, becoming significant for us. How the One Health approach was illustrated. Different entities were committed at different levels, probably for the first time. At the EC level, the EC Directorate, Agri and Research were working together. At the national level, Ministry of Agriculture, Ministry of Health and Ministry of Research were working together. The respective public institutes working together. In the scientific community, Med and Vet Institute were working together. It was a real One Health program, and all actors had a clear role to play, and that was promising. My last word is in conclusion. This success story is a long-lasting process. 20 years were needed to create the mutual trust and to allow the consortium to become a strong partner to work with the European Commission in agreement with the member states. I wish you all the best for the future. Thank you.
Thank you, André. Yes, it is a long story. 20 years ago it all started 20 years ago. Thank you. Yes, and EJPs are big projects. They are the first big projects that which the grant is over 20 million euros. Before, the projects funded by the EU were much more smaller in terms of grants, of amount of resources, financial resources, but also in terms of a number of partners. So we've learned to work together over this last 20 years. We are now 44 partners from 22 EU countries. and 20 member states. We now know how to work together, and this gives me the opportunity to jump to one of the aspects that were developed through this large-scale collaboration. It's the institutional networking, and I think, Isabelle, you can let us know how the EJP contributed to promote, to foster institutional collaboration. Thank you, Isabelle.
Thank you, Arnaud. Yes, indeed. One of the major keys of success within the One Health EJP was bringing together scientists, facilitating networking and capacity building. As you know, networking fuels innovation and progress within the scientific world. The One Health EJP stimulated the exchange of knowledge and expertise among researchers of diverse backgrounds within human, animal and environmental health, including microbiologists, epidemiologists, veterinarian, bioinformatician and environmental scientists. This interdisciplinary approach allowed a more holistic understanding of complex One Health issues. Through networking and working within the projects, scientists were able to share data, to pool their resources, and leverage each other's strengths to tackle cross-border challenges in One Health. By bringing together experts from these different fields, the One Health EJP has made significant strides in understanding transmission of zoonotic and foodborne diseases. This collaboration has not only led to the identification of emerging threats, but also resulted in the development of more effective prevention and control strategies. The partnership, for example, has enabled tools for a coordinated surveillance system for antimicrobial resistance. This system can provide valuable data to inform policies and interventions at national and international level, helping to combat the rising threat of AMR. The One Health EJP initiative has not only brought together scientists from different disciplines, but has also fostered collaborations between different research institutions. The Scientific Steering Board played a vital role shaping the direction of priorities of the One Health EJP. The frequent interaction amongst its members contributed to the harmonious alignment of goals and strategies. After the COVID lockdown, I really enjoyed attending the SSB meetings in Riga and Vienna, to able to interact again in a more informal way with my colleagues of the different research institutions. I think also these informal interactions play an important role to build trust and to strengthen the relationships.
Thank you, Isabelle. So this is an institutional adventure, but this is also a human adventure. And above cross-border collaboration among our partner institutes, as well, there is human behind that. And Hein, maybe you can give us some legacy of what was the One Health EJP.
Thank you, Arnaud. Indeed, is it
yeah, better.
Indeed, after what Andreas told about how it started and what an impression is of how people work together, I think we have to think also about the legacy. How do we want this One Health EJP to be reminded after a few years? And I think the most important thing of the One Health EJP is its network. We all together were able to construct this vet food safety network. We learned what it was to work cross sectors: animal health, public health, food safety. We learned and we filled in, we defined the word one healthiness, a word that we didn't know, but I think we start to use it. And it doesn't mean that one organization, one consortium, one partnership, whatever, wants to take over what happens in animal health, in public health, in food safety, or the environment. No, it's about working together. And it's so simple. I mean, all projects are dealing with that, working together, collaborating. That's what we heard from the minister, what we heard from the institutes, what we heard today, what we will hear far more about the coming days, today, tomorrow. It's also what a key word that we learned about is also stakeholders. It's not, we're not doing the work only for ourselves or making publications, and of course that's important, but it's also really important for whom are we doing this? What are we doing, but what is the use of it, and how can we use it? And that brings us to the last point. It's about the effect of the results. It's about the midterm, the long term, the outcomes and the impact. And these are also two words that we use all over the time, outcomes and impact. We bit by bit start to know what it means. And it's really important that this is what we are doing. We are thinking about MedVet, and we're working MedVet and food safety. We're not, well, it's not in the label, and the environment is not in the label of the One Health EJP, but it was a really good idea. Thank you, André, and all those that were involved in the beginning, to label it One Health. It was a little bit attractive, stirring up things, sexy maybe, to call it One Health. Although one dimension was not present, the environment was not there, because there was not an environmental agency at the time that could be included. So there was no third dimension. But as we got along, and that we talked about the strategic research agenda, and we added, or we could add in the stakeholders, the European Environment Agency, who, by the way, were very much interested in the work that we are doing. It turns out that also the researchers, they started to work on thinking about the environment, implication of the environment, the spread of resistant genes, of bacteria, pathogens, and so on. So the environment is really there, and it is One Health. The most important thing is, I make it short. I have to make it short. I understand what we did as well, and I encourage all of you who have not already had the chance to look at the strategic research agenda that we had in 2018. And there is described that what we are doing, it fits into what we call prevent, detect, response. The minister has already referred to that as well. And it's an idea of, I'm very thankful for you and André, to continue using that. We call it now the integrated strategy matrix, but there is work that we need to do on surveillance, on the laboratory, the procedures, but also reference material, also joint risk assessment, also risk management. All these different aspects are so important for prevention, detection, and response, and that's something that we decided in 2016 or something about that, and we are still following this. So we keep this backbone alive. That's for us the interdisciplinary reaction. That's for us the One Health model, let's say, for the One Health EJP. About the stakeholders, I'm very pleased that we were able to have these 7 so important stakeholders, international stakeholders on board: EFSA, ECDC, EEA, EMA, also WHO, Europe, OIE, WOA, and FAO. So all are there. They find an interest in what we are doing. So that's very nice to see that we have this added value. We have something to offer. It will not stop. Well, we will have our last meeting today and tomorrow. Then formally this will stop, but it will not stop. It will not stop because we are a community, a unique One Health community in Europe. I'm convinced that there is a layer, a bottom, a basis that is there that will go on, that will find the strength to move on. And so the MedVet Association will certainly help us. And finally, what we have to do is to not only do the research, but also think what are the results, what are they aiming for, who is going to take them up, how can we turn results into outcomes that others can use and have an impact for society, for science, and for policy. Thank you very much for all of you who have helped in this. I'm very proud to be able to, to be here at least. Thank you very much.
Thank you, Hein. Very nice talk, because you've just unfolded all that we are going to address at this final meeting. In terms of working with the stakeholders, by the way, we have tomorrow a special session that I will present about the outcomes of our discussion, our last discussions with the main stakeholders that we have identified, the ones that Hein told you about right now. There is a last thing that we can say in introduction about this One Health EJP. As I said earlier, this is a large-scale project, and it requires lots of resources to be put in place. And among that, we need skilled persons, and I would like just to name them. First of all, regarding the administration and the finances, you know that the EU has complex rules. It's worth saying that. And I would like to thank the support team, Lucina, Richard for the finance, Lucina for the administration, Laurie, who came lately, but who's been very, very effective, and finally Audrey, our intern. Thank you very much for the work you've performed over these 6 years. Then, of course, with a large project as One Health EJP, you need to communicate. It's very important nowadays. And we've had several persons. There has been a turnover, but the University of Surrey has always been here to perform a very, very effective communication work and branding work. You can see this branding. This is made by Elaine. Thank you, Elaine. We have Jenny and Aurore and Jack. And this is very important to put resources for the communication. Thank you, Rob, for having coordinated that. And then last, this is the core, the heart of the work, the project management team, the work package leaders. And that's the ones who organized everything together with the support team, the communications team. And we have 7 work package leaders, 7 deputy leaders, and a certain amount of collaborators, among which Ludo, who's done a terrific work about just quietly discussing with stakeholders. He was in charge with Anne-Marie and Pika. He was in charge of discussion with the stakeholders to retrieve their needs and to address them. Thank you, Ludo. Thank you, Pika. Thank you, Anne-Marie. As Hein said at the beginning, it was needed to know the gap, to identify the gaps and to set priorities. And this has been done by Work Package 2, by Ariane, who's here. Ariane, thank you. And Lucia, Ariane from RIVM, and Lucia from Madrid, la Universidad Complutense de Madrid. Thank you, Ariane, for having performed this, and Lapo, but I don't think Lapo is here, for having performing this identification, priority identification work. Thank you. Then, once you've set channels of discussion with stakeholders, once you've set the priorities of the work that you will perform, you need to implement the work. And for that, there has been Work Package 3 with Hein as scientific coordinator, but also the one who monitored all the research, the 24 research projects that we implemented. There is Work Package 4. Karine, sorry, I did not. Work Package 4 was monitoring among other things, was monitoring the integrative projects. We had 7 integrative projects, 6 integrative projects, plus 1 simulation exercise. But she will talk more about that later on. And we have work package 6 about education and training. So we implemented 17 theses, more than 40 short-term missions, and approximately 10 workshops. It was a success. Thank you to all these people that have done quite a lot to ensure that we have good success and that we are successful now. Thank you. That's a rough view, but a quick view, because we now need to jump to the next session. That's how the 1LCJP has been over the last 6 years. If we can add 2 years of preparation earlier, as André said. I would like now to give the floor to Ludo and Karine and Ludo, sorry. For the next session, I would like to thank you, André, Hein, Isabelle.